Here's an incredible article, and when I saw it, I was like, I have to cover this because it's not necessarily only the information in this article that matters, but it's the bigger picture that means so much here. In this article, public health experts are confusing Americans in the name of wokeness. Pretty much all health policy right now is being confused in the name of wokeness. Science is out the door. I mean, when you look at all the details of what has happened over the past year, I've been shaking my head the whole time because I've read the science where everybody else has watched the news. Before we dive into this, be sure to subscribe, hit the notification bell, and be sure to hit that bell because the subscriber button hardly does anything. If you want to know when these videos come out, you got to hit that bell. Also, smash that thumbs up button and put in the comment section your thoughts on this topic. And also, if you have any ideas and thoughts on topics you'd like me to cover or news pieces you'd like me to cover, post them in the comments below and I will take those very seriously into consideration. Let's go ahead and dive into this because, as I mentioned before, much of the health chatter over the past year and a half has been utter nonsense. You know, when you look at the science of lockdowns, the science of mask wearing, the science of all of it, it hardly makes any sense. And when you look at the policies that are being made with the lockdowns and the mask wearing, when you are looking at a virus that 99.997% of people survive, and you're looking at the devastation with the obesity and the depression and the anxiety and the suicides and the alcoholism and the drug addictions that are all coming out of this, it doesn't even make any sense. But you know what? Most people prefer to stick their head in the sand and not actually pay attention to the real facts. But let's look at this because this article here really lays out something that is important to understand in general, what's going on in the broader picture of health policy and just the utter nonsense involved in this. So this guy first goes on to talk about, you know, how he went and was at the Pentagon as a speechwriter and basically, you know, just talking about some of his past history. Now, he goes on to say, I was reminded of this while listening to Rochelle Walensky, the director of Center for Disease Control and Prevention, CDC, at the recent White House news briefing. Here's how she updated Americans on the spread of the virus. As of yesterday, we have confirmed 1,277 cases of the B.117 variant across 42 states, including the first case of the B.117 variant with the E484K substitution that had previously been found in the UK. 19 cases of B.135 variant have been found across 10 states, and 3 cases of the P1 variant have been found in 2 states. Now, I heard this the other day. I heard Anthony Fauci talking about this, talking the same jargon. I go, what the heck was that? Like, I don't even know what he's talking about. And I didn't even go to figure out what he was talking about because I didn't care. I don't really care about anything the guy has to say because he's pretty much just a puppet at this point. He's wrong about everything and he just makes up stuff as he goes. You know, one day he's telling you to wear one day he's telling you to wear no mask, then he's telling you to wear one mask, and then he's saying wear 2 masks. I mean, the guy just keeps making stuff up as the day go on. So, got that? Well, me neither. I consulted some medical experts, and here is an English translation of what she said. We have confirmed 1,277 cases of the UK variant across 42 states, including the first case of the UK variant with a mutation of the spike protein that had been seen in the South African variant. The UK variant with this South African mutation had only been found in Britain, but has now appeared in the United States. In addition, 19 cases of the South African variant have been found across 10 states, and 3 cases of the Brazilian variant have been found in 2 states. Well, he goes on to say, that's a lot clearer, isn't it? And that's the same thing I'm thinking. It's like, oh, well, if that's what they meant, why didn't they just say that? And why didn't Walensky just say that? Well, maybe like the generals I once worked with, she's so immersed in the medical jargon, it sounded clear to her. For some public health experts, that may be the case, but I suspected there's something more pernicious going on here. Public health experts whose job it is to inform the American people are instead confusing them with the name of wokeness, or in the name of wokeness. When the variants began arriving, experts and the journalists did refer them by their place of origin. This was in keeping with tradition, okay? And this is something that's very important. So people are saying like, oh, if you call it the China virus or you call it the Wuhan virus, oh, that's racist, or that's you're being disparaging towards the Chinese people. That's ridiculous. This is just tradition, how pretty much everything has been named over the past 100 years. It's just what we do here. To give you an example, MERS is called the Middle East Respiratory Syndrome because that is where it originated. The Ebola virus is named for the Ebola River in the Congo because that's where it came from. The Zika virus started in Zika Forest, Uganda. The Lassa fever is named for the Nigerian town where it originated. Marburg virus is named for the German city where it first emerged. We refer to the guinea worm disease, Japanese encephalitis, West Nile virus, and German measles, as well as Lyme disease, norovirus from the Norwalk, Ohio, and Rocky Mountain spotted fever. And so basically what they're saying is that why are they making up all this crazy jargon when they should just call it what it really is and where these things are coming from? But when the pandemic began, and some suggested calling this pathogen the Wuhan virus, or as President Trump called it, the China virus, they were accused of being racist. Calling it the Kung flu, as Trump did, is bigoted. Calling it the Wuhan or China virus is not. The virus emerged in Wuhan, China. Right? That's what they're saying. But in the name of wokeness, experts decided to give the virus a bulky name, SARS-CoV-2. Most Americans just call it COVID. Then the variants began arriving on the shores. In the name of clarity, many experts and journalists began to correctly refer to them as UK, Brazilian, South African variants. But when news organizations got called out for hypocrisy, the use of the source names quietly dissipated, and we began to get the alphabet and number soup we are now seeing every day. Okay, this is ridiculous. Like I said, I was confused by this, and this actually cleared it up for me. The problem is no one knows what they're talking about. Here's Anthony Fauci, chief medical advisor to President Biden and director of the National Institute of Allergy and Infectious Disease. He was also the medical advisor to President Trump, and he is nothing more than a puppet who makes stuff up as he goes, not arguing that he has a lot of experience and is capable of being intelligent, but he just plays politics. Explaining the news that the Johnson & Johnson vaccine has 82% efficiency against the South African variant. That's really very important because even though the spike protein that was used and expressed in the vaccine was the spike protein against wild type virus, namely the virus that is D614G, not against the B1, I mean, you get it, because they're just throwing all these random numbers out there. It is unlikely that experts will stop speaking in gibberish anytime soon. So here is the cheat sheet to help you translate what they are saying. Okay, so if you care enough to actually know the cheat sheet, here it is. Like if you hear the D614G or wild type, that's the original COVID strain. P1 and P2 is Brazilian variants. B117 is UK. B1351 is South African variant. So when you hear these politicians talking nonsense and gibberish, this is what they're saying. But as I said, when you speak in the bigger context of as to what's happening right now, nothing's based on science. Everything is based on politics and wokeness and just absolute stupidity. When you go and actually read the studies yourself and you read, hundreds of studies that are out there at this point, you realize real quick what's going on. And then as you actually break down the different options and treatment protocols and everything that are available, but yet they demand everybody gets a vaccine, it makes you really start to question things. So a lot of people get mad at me for saying these things, but I've done the research. I've talked to experts. I've done an enormous amount of reading. I am not an expert in immunology. I'm not an expert in virology. However, I've had to take courses on it. I had to be tested at a board level on some of these topics. I know how to read the research in it. So I am not an expert, but I know how to understand what's happening. And when you truly understand it, all you can do is scratch your head. There's a PhD neurologist that I take care of. And, it's funny because one of the days this individual came up to me and they said, "So what do you think about what's going on?" I was just like, well, I'm not here to push my opinion on other people. I don't really care if you believe what I believe. You need to believe what you believe. And so I said, well, I don't know. What do you think? And they're like, "This is nonsense." I'm like, "Have you read the research on it?" And then this individual says, yeah, and that's why I know it's nonsense, because it doesn't make any sense. I read this, this individual started going off, and I'm like, yeah, I'm in the same boat. I'm in the same boat. And anybody who is highly, highly intelligent is coming across the same concepts that you are. And so anyway, understand that when it comes to health policy right now, and also a lot of the decisions being made, it's just being made off of politics, off of nonsense. And, especially in the United States, there's so much political bantering that it's just like one side versus the other. And they just, one side believes this, the other side believes that, and it hardly has anything to do with science. It literally is more just about political bantering and trying to get people to take sides, and it's horrible. It's horrible for the country, and it's horrible for people's health. They just need to be honest with people and tell them the truth and give them the treatments that they need that have been proven to help, and not block many of these very, very productive and efficient treatments that are available, just so that they can push the vaccines on people. So anyway, all interesting information. Put your comments and thoughts down below.